Hello, I'm Dr. S.S. Gambhir, Senior Consultant Plastic Surgeon, Sir Gangaram Hospital. This is one of my teaching video on rhinoplasty. What we will be talking about in this video is what the patient need to know about rhinoplasty, about the newer procedures, about the rhinoplasty, is it right for you or not, the most frequently asked question by the patients, and certain before and after photograph. As we know, rhinoplasty is not a new procedure. Reconstructive rhinoplasty is there since 600 BC. It was started in India by Susutra by doing forehead reconstruction for nose, because at that time the criminals were punished by cutting off their noses, and it was reconstructed by that. But today's topic will be talking on cosmetic rhinoplasty, so we're not talking about forehead flaps. But this cosmetic rhinoplasty is also not new. It's nearly 100 years old. But in this 100 years, a lot of advancements have taken place. Now, as we know, this is one of the most difficult operation. Different noses require different technique. No two noses are same. And it is the second most common procedure being done worldwide, cosmetic procedures after hair transplant. And in last 1 year, about 3 lakh rhinoplasty has been done in India. When we talk of rhinoplasty, we'll be talking of certain procedures like cosmetic or functional, or it can be done open or closed, or it is a primary or a secondary rhinoplasty. First, coming to the cosmetic procedure, the reason for doing cosmetic rhinoplasty is your nose may be too large or too small that does not fit to the face, or your nose may be malaligned, misshapen or crooked, or deformity is present since birth and you want to correct it now. As we know, the nose forms a definite proportion to the face. If you divide the face into vertically 5 parts, so nose forms 1/5 of the part of the face, and if you divide the face vertically into 3 parts, the nose length forms the 1/3 part of the face. So all these procedures we try to achieve these proportions to give a good cosmetic result to the patients. This is one of the photograph of a model. You can see the nose forms the 1/3 part of the face. This is a patient in which we did some tip work as well as hump removal to form the correct proportion to the face. This is another patient who had a very large nose and there was a hump, so we have done the hump correction as well as decrease the length of the nose so that it looks in good proportion to the rest of the face. Now coming to the functional rhinoplasty. Functional rhinoplasty is done when the patient has trouble breathing through the nose, and these functional rhinoplasties are covered by insurances. And the main reason for decreased breathing of the nose through the nose is, if you see the sinuses, they are full in the left side upper part, and you can see there is turbinate, is hypertrophy, and there are a lot of polyps are there. And if you see on the right side CT scan, the septum is deviated. The septum in certain patients is deviated so much it touches the lateral wall. And the third important point is the collapse of the internal wall, which need to be taken care when we are doing rhinoplasty or when you're doing a functional correction. Coming to open and close rhinoplasty. Open rhinoplasty is done by giving a nearly invisible scar on the columella. This is not visible after 3 to 6 months of time, nearly not visible. You have to look for it. And it is done for the patients in which patient has a crooked nose and lot of anatomical corrections need to be done. Good for revision cases, and of course whenever you do such extensive dissection, there is a swelling is there, and certain patients they require a lot of tip work to be done. So for these patients, open rhinoplasty is good. Whereas closed rhinoplasty doesn't give any visible columnar scar, rest of the incision is same, there is less dissection, there is a decreased swelling, and minimal tip work is required. Now if you see this patient, we have done an open rhinoplasty. Septum has been placed into midline and the tip has been narrowed and heightened, and you can see the scar is nearly not visible even after around 2.5 to 3 months of time. Another patient in which the septum has been corrected to midline, the tip has been placed beautifully in the center with good tip projection. This is the patient in which we did a closed rhinoplasty. You can see we have not given a columnar incision. Rest, the rim incision is there. Columnar incision, lateral columnar incision is there. The lower lateral cartilage has been brought down. The correction has been done. We don't give a columnar incision in this patient. So you can see this patient pre and post. The tip work has been done, and you can see the tip has been narrowed. The dorsum has been augmented. Coming to the revision rhinoplasty or Secondary rhinoplasty, there is always a chance, 5% chances of revision in a center. So main challenges when we are doing revision rhinoplasty is that because you have already consumed the cartilage which is there, like the septal cartilage, sometimes even the conchal cartilage has been consumed. So you have to go for a distant cartilage. So you go for rib, and whenever you go in these revision cases, there's a lot of scar tissue, and certain times we don't know what the other person has known, so you go into unknown areas prior to surgery. Now if you see this patient, nowadays with advancement in last 100 years, the understanding of the anatomy, the cadaveric dissection, we now know what needs to be done to prevent the complication. So we try to preserve the anatomy. You see the photograph of this patient. This patient is having a septal collapse, there's inverted V deformity which is there. So these deformities are being avoided nowadays with the advent of modern anatomical knowledges, and the result nowadays are much more natural as compared to before. So this patient with an inverted V deformity, this deformity has been corrected, the dorsum has been augmented with full support. Now the newer things in rhinoplasty is the ultrasonic burr or ultrasonic osteotome. This has come into place because it causes minimal tissue injury. It is based on the principle that we used in scaling in the dental part. We use ultrasonic vibrations, and this causes cutting of the bones. But the main disadvantage is that large dissection is required if you're doing this using this ultrasonic burr. And definitely if you're not damaging any tissue, there's less downtime, there's less swelling is there. Now the next question comes is, patient always asks, is the rhinoplasty right for me? Of course, if you're in good health and you're above the age of 16, in males, in females we take as 15, and you're a non-smoker and your nose does not fit your face, and either it's misshapen or crooked, or you have trouble in breathing, you are the right candidate for the surgery. Now the main questions being asked by the patients are, is the procedure done under general anesthesia? Yes, the procedure we prefer doing it under general anesthesia. Only those patients which require minor tip work or certain minor procedures we can do under local anesthesia, but all major rhinoplasty is being done under general anesthesia. So how long the procedure takes? The procedure is dependent on the time is dependent on what you are doing in the procedure. If it's a revision surgery or a complex crooked nose, then we require around 5 to 7 hours of time. And if it's a minor tip correction, you can do in 1 to 2 hours of time. But on an average, we talk about 2 to 3 hours in a rhinoplasty procedure. So what is the recovery time? So once you have done the osteotomy in the patient and applied the splint, so these splints are being removed after 10 days of time, so till the time bones are healed. Of course, it takes around 3 weeks of time for the bone to proper fix itself, but after 10 days you can remove the splint. In certain centers they remove after 14 days of time, but in our setup we remove in 10 days of time. And after that you can go to work. If you want to do work from home, you can start after 2 days of time. Otherwise, for all office social activities, you should provide for at least 10 days of time. So when a patient can do workout? Normally, I prefer that they should do after 8 weeks of time. Normal light walks, they can start after 2 weeks, but heavy gym workouts or running to be done after 8 weeks of time. The important question, how much it costs? In our center, it costs between 40,000 to 2 lakh depending on the procedure required. The other question is whether it can be combined with any other procedure or not. Yes, it can be combined with any other procedures as long as you don't compromise the safety of the patient, like facelift, genoplasty, blepharoplasty, tummy tuck. You can see in the photograph that we have combined with genoplasty with good results. The important thing is that you don't compromise the safety of the procedure and don't carry out the procedure very, very long. Now, main points to remember is that rhinoplasty is a complex surgery and each and every nose is different. So different noses require different techniques to give the desired results. And they definitely can improve the appearance of the face, nose, and improve the breathing. So with new techniques which are available nowadays, with modern understanding of the anatomy, the results are absolutely natural. Now, thank you so much. Now, if you have got any further query, you can see my website, drgambhir.plasticsurgeon.com, or you can mail to me, drgambhir1@gmail.com, or you can contact us by phone. You can book an appointment. We are there to help you. Thank you.